So I think the next part that comes after you get the biopsy is something called the Gleason score. And it's sort of divided up into risk groups from low to intermediate to high and very high risk. And it gives you a different score from, roughly about 6 to 10 or so. And the higher the score, the higher the risk. Dr. Jatwani, can you go into a little bit about what the Gleason score really means and what does that really correlate with?
Yeah, so I think whenever a patient, this is a common terminology that you will hear your urologist or an oncologist whenever they're going to be discussing with you about your prostate cancer. They'll talk about Gleason groups and or Gleason score. I think the biggest takeaway from our whole presentation, if you can take, is that the higher the Gleason score, the chances there is a good probability of saying that the disease is aggressive. So the Gleason score of 9 or 10 would essentially say or mean that you have an aggressive kind of prostate cancer. That does not necessarily mean that that whether you have localized or metastatic, which we will go into later. But I think the biggest takeaway is the higher the number, the more the disease is kind of more aggressive, and the lower the number, the less aggressive the disease is. And in isolation, looking at Gleason score can have some value, but what we also tend to look apart from Gleason score is to look at the PSA, to look what are the other stages that the prostate cancer has. So it is one measure of understanding how your prostate cancer is behaving. So yeah, I mean, Dr. Tawagi and Dr. Kurian, would love to hear how you counsel your patients on it.
Sure. So I normally explain it to patients that, like you said, a lower grade or a Gleason score that's lower means that when the pathologist is looking at the slides from the biopsy under the microscope, it resembles more closely to a normal prostate cell. But then the higher the number, the more ugly the cell looks, the more it looks less like a normal cell. And to your point, it does indicate that the cell has changed a lot more from its normal self and perhaps can indicate a more aggressive kind of disease. But alone, it's not the whole picture. We still need to know the size of the prostate tumor, which I know we'll get into, the PSA level and other features as well.
Right, exactly. It's one piece of the puzzle, I would definitely say.